Everybody, how is it going today? I hope everybody's having an amazing, wonderful Monday. Yes, it is Monday for everybody in quarantine that has forgotten what day it is.
It's kind of easy to do nowadays, right?
My goodness. Yeah, it's crazy stuff. I mean, so how's everyone doing? How's everybody surviving? First of all. And then secondly, we're going to talk about diabetes this week. So we're going to kind of switch gears. We did cholesterol last week. We're going to switch gears and we're going to talk about diabetes because, man, it's a big thing. And the thing about diabetes, there's a big part of it that has to do with nutrition, yes?
Absolutely.
And what is everybody doing right now poorly at?
Nutrition.
You're sitting at home, you're eating, you got all this bad food and all these things that you just think it's like, oh, I can't get out. Yes, you can. I'm not eating anything bad. We're eating great food.
Yep.
We make decisions and it's a priority to us. We don't accept anything less. So, Doc, take it away. Let's hit diabetes and why drugs are not your answer.
Yeah, diabetes. Diabetes has been a passion of mine. I lost my grandparents to diabetes way too young, and over the years of treating diabetics, you just learn more and more about the sad story that diabetics live, and it's not getting any better. And really, what we should say is it's getting worse with time. We're seeing more and more percentage of the population being diagnosed with diabetes, and unfortunately, what we used to be able to call adult onset diabetes is no longer adult onset. We're seeing teenagers developing this disease process, and yes, it has a lot to do with what goes in your mouth and the lack of exercise. But at the end of the day, the damage has occurred, and now you've developed a metabolic disorder called diabetes. See, we can't cut you open and remove your diabetes because diabetes is a metabolic disorder. So there's many different players when it comes to why your body's lost the control of blood sugar. And so typically, in most diabetics, Doc, as you know, they're diagnosed on a routine office visit. You go in for your annual checkup or you're going in for the flu. For whatever reason, you get some basic blood work ran. You go back to your doc for those results. The doc sits you down, and you can already kind of tell he doesn't have anything good to tell you, right? And sure enough, and from what most of my patients have told me how the process goes is, before the doctor really even explains to you what diabetes is, he's got his prescription pad out. He writes you your first oral diabetic medication. They typically will just tell you to lose weight, exercise, and improve the way you eat. And that's pretty much the extent of the counseling that you get on that first visit. And for those of you that are diabetic, for those of you that have been struggling with this disease process, that's pretty much the extent of the counseling that you get throughout the disease process. And so, what we typically see, here's the deal, guys. Diabetes medications, what they're designed to do is to drive the sugar into different parts of your body. So the reason why the standard of care is the disease will progress, meaning that 5 years from now, usually you're not in a better position, you're in a worse position. Again, it's because those drugs are just covering up symptoms. They're just driving the sugars down. But insulin resistance, those of you that have type 2 diabetes, insulin resistance is the problem. And so just driving sugar into different parts of your body does not fix the insulin resistance. So what happens, Doc, as you know, it just gets worse and worse. All those underlying issues continue to fester. More and more inflammation's developed, higher blood sugars. So at the end of the day, you go back to a follow-up appointment a year later, and sure enough, without you changing anything, your sugars are now worse. And so what's the doc want to do? Well, the doc wants to increase how much medication you're taking, right? A lot of type 2 diabetics get to the point to where they become insulin dependent. And so now you have to inject yourself with insulin. And the sad part is, and I'm sure you've seen this with the diabetics that you've worked with too, Doc, is, once somebody goes on insulin, that's really where we start to see their health decline pretty rapidly.
Yeah.
Is that what you've noticed, Doc?
Yeah. Somebody said there's an echo. I was trying to see if there was an echo. I don't hear it. So hopefully it's better now. But yeah, guys. And, one thing that I always see people want to talk about is say like, yeah, I've got diabetes, but you have the biggest excuse in the world. And what would that excuse be? It's
definitely genetic.
It's got to be genetic. So it doesn't matter if I eat good. It doesn't matter if I eat bad. It doesn't matter if I eat sugar, pizza, and cake and bonbons all day long, or drink 12 and Do you know people actually do this, Doc? They 12-pack of soda every day. Unbelievable, right? Or if I eat kale all day long, I'm just going to be diabetic and I'm doomed. And you've been told that from the beginning. You've been told that your whole life, and you believe it, but you've been lied to. And that's really what we're trying to get at right now, is that you've been lied to about it, guys. Like that is not the case, and you don't have to do that, but you do have to do something different. You have to start looking at it different. You have to start treating it differently. You have to start taking control of your health. You have to get tested properly. Just because you have an A1C that's often high doesn't mean you have to be on metformin. I always ask the question is your diabetes because of a lack of metformin? Is your diabetes from a lack of glyburide, Jamumet, whatever? Or is it from something? Like, what's causing it? And again, that's the question that you should be asking your doctors when you go in there is, well, why am I diabetic? And sometimes, and I'll say this here because I like saying it, I haven't said it in a while. Sometimes you have to just, because they're like, well, change your diet. Like you said, go change your diet. Well, what the hell does that mean? Eat Splenda? I should eat Splenda and things with no sugar and artificial sweeteners? That's my answer? God, no, that is not the answer. And they tell you to lose weight, but they don't tell you how to do any of this stuff. And sometimes, guys, you have to look at yourself in the mirror and say, I'm not big bone, I'm just fat. And when you can own it, you can say, okay, I'm fat. It is what it is. I understand it. It's my fault. It wasn't your mom's fault that you're fat. It wasn't Dr. Miller's fault. It was your own fault. So take advantage of it. Do something about it. Put the food down. Pick up a 2-pound weight. Go on a walk. Start somewhere. And you're probably hurting and you're suffering and you're in ache and you're pain and your joints hurt and your body hurts. So you take more ibuprofen. So now you got more gut issues, and then the gut issues is getting bigger. And then I need more clothes that are bigger, and I need more insulin, and I need more drugs. It's not the answer. It's a vicious cycle you get stuck in. And then that diabetes process causes a lot of problems. Because guess what? Do you think diabetics are safe right now at this time and where we're living? That's a factor. That's a risk factor right now.
Absolutely.
Well, what are you doing about it, guys? And that's the whole point. Are drugs your answer? Do drugs make your diabetes normal on a blood work? I guess, yeah, sure. But are you healthy? Do you feel good? It's like you have normal blood work, but you feel like crap all day long. Is that worth it? Right. Or would you rather just make a change and do something different and then not have to go to your doctor to just tell you be on more drugs? It's crazy, guys, but it's a decision. It's all about making better, gooder decisions.
Yep. And it's frustrating. I mean, I want to give you all the benefit of the doubt, those of you that have been struggling with this disease process, because, you're a lot of you guys are looking for answers. If you Google diabetic diet, hundreds of diabetic diets are going to come up and they all contradict each other. So you're like, well, what the hell do I do? Right. Your docs are telling you, well, if, they don't talk to you about how to eat better. They just tell you take more drugs. For those of you that are on insulin, a lot of you guys are feeding your insulin, feeding your body. You're taking insulin so that you can eat whatever you want. So if I just eat whatever I want, I got to take more insulin. And see, here's the scary part. Here's truly the scary part, because, guys, we're talking about a disease process that is the number one cause of heart disease, which is the number one killer in our country. It's the number one cause of blindness. It's the number one cause of kidney failure and having to go on dialysis. It's the number one cause of liver failure, right? So you've got all of these issues that diabetes leads to. And see, as long as your A1C is in a normal range under 7, they tell you that you're most likely not going to develop the complications. And guys, there's just no truth to that. I have seen patients over the years, they develop peripheral neuropathy. They've lost toes. Their eyesight changes every year. They're dealing with all these issues, but yet their sugars have been so-called under control with the drugs. But again, we have to remember that the drugs does not fix the disease process. Therefore, the drugs doesn't reduce your inflammation either. And so if inflammation leads to all disease, why is it that if my sugars look good on a piece of paper, why is it that I'm still developing these complications? Well, again, guys, because the drugs doesn't fix the disease, right? The drugs is putting a blindfold over your face to say, don't worry, your fasting glucose is within normal limits. And so we're managing this disease process the best we can. Because that's what they will tell you, guys. If you stood up and you said, enough's enough, I'm going to beat this damn disease, and you went back to your doctor and said, Doc, just tell me what I need to do. I will run through a brick wall if I have to. Just tell what I need to do to beat this disease. What most of your docs will tell you, they'll look at you in the eye and say, It's not possible. They will tell you the best that you can do is take the drugs to slow down the inevitable progression of this chronic degenerative disease process, and they'll tell you that's the best that they can that you can do. And the reality is that is the worst thing that you can do, is ignore the disease and just take a drug every day to reduce the number that's on your your meter. That's like playing Russian roulette, guys. You are doing absolutely nothing to improve your health, and you are just waiting until another disease process comes along. Because the reality is, guys, is every time you go into your doctor, you walk in there with a label across your forehead that says type 2 diabetes. So they run some basic blood work, cholesterol's high, and get this, even if it's not so-called high, they still want to put you on cholesterol medication, standard of care. Blood pressure starts to go up, more blood pressure medication. Sugar starts to go up, more sugar medication, right? And unfortunately, guys, because diabetes has such a negative impact on your physiology, you develop a lot of symptoms. But anytime a new symptom comes up, anytime a marker gets out the outside of the normal laboratory range, what's their answer? It's always another drug. I mean, doc, we see people coming into our office that are on 6, 10, 12 different drugs, and a lot of them they're taking multiple times a day because there's so much symptoms, so much dysfunction going on.
That's crazy. It's crazy. I wrote on there, like, when is it time to do something different? when is enough enough? when are you? I mean, you're gonna wait until it's like too late, until you're too sick, or you're gonna do something about it, you know? And that's what I'll kind of go off on a tangent in a minute. But we have a couple quick questions here. Heather says that she recognizes. She said, I will say I'm fat, and my friends get mad at me for saying it. Well, yeah, I mean, obviously they're like, no, you're not. You're fine. You're doing the best you can. But like, Heather, as long as you're working and you're working towards change, you're gonna be okay. As long as you're putting down the food that you're not supposed to be eating, and you're putting in the right foods and following food allergies and getting tested and doing things, you're gonna be okay. It's just gonna take time. It takes time. And diabetics are there's limiting factors, right? Like you don't heal the way I do, the way younger people do, the way people without diabetes. So it just takes a little bit more time, and you have to be patient. And then, Doc, there's another question for you here. It says I have to hop off another call for a few minutes, but Jennifer is doing rocking the elimination diet and doing some cool stuff in the journey to wellness, and she's doing really great, asking some awesome questions. But she wants to know how you would explain someone who is type 2 diabetic what alcohol does to the blood sugar that day, maybe days after, and she'll check back later.
Yeah, so when we're looking at diabetes, the 4 main organs that we need to focus in on is the liver, the pancreas, the adrenal glands, and the thyroid. So those organs have direct impact on controlling blood sugar in the body. Insulin resistance truly occurs within the liver. If you're drinking alcohol and you're a diabetic, there's no way in whatever that you're going to reverse your diabetes. You are damaging your liver. Do I like to enjoy an adult cocktail every once in a while? Yeah, every once in a while I do, right? So what do I do when I do that? Well, I do a lot of support with my liver. Guys, your liver, you can't live without it. And so many of you are walking around with a fatty liver and have no idea. Why? Because when your liver enzymes, it has to get way outside the normal range before your doctor starts to get concerned. And their so-called normal range of your liver enzymes, oh my gosh, cut those ranges in half, and that's really where your markers should be, right? But alcohol stresses the liver. See, when you consume alcohol, that liver now has to put a bunch of things on hold so that it can process that alcohol through your body, because it knows if it doesn't process the alcohol is going to cause major damage, right? And so the liver will put a lot of other necessary things on hold to process that alcohol. How long does it take that alcohol to process? Many hours, right? So during that time, when it should be helping to maintain blood sugar or glucose control, it's more focused on processing alcohol through the system, right? But at the end of the day, guys, if you're drinking booze every night and you're slamming back the shots and you're doing those things, number one, you got to be doing some major liver support. And guys, I'm not condoning that kind of activity, but there are a lot of people out there that like to have a cocktail or two every night. Okay, you do you, but I'm telling you right now that it's only a matter of time before you start to regret that activity, right? And if you're a diabetic doing those type of things, I mean, guys, you need to go through a major healing process. And listen, yes, I mean reverse diabetes. I mean completely walk away from it. No, never have to worry about a diabetic medication again. Never have to worry about low sugars and high sugars. I mean, guys, it is possible, and it happens every day with the patients that we work with. But your body has to heal. I don't have a magic herb that's going to all of a sudden, bam, now your diabetes is gone, right? That's not the way it works. So we need to get your body through a healing process. And if you're consistently putting alcohol in your body, I'm just going to tell you, you're not going to be able to heal very fast. That is for sure. And guys, it's a priority. I mean, what's your priority? Is your priority to, be there for your kids and grandkids, or is your priority to get hammered every night? And if your priority is to get hammered every night, I don't even know why you're watching this video. I mean, we're not the right place for you. You're never going to get healthy. You're going to be stuck in that symptom suppression model for the rest of your life. Because again, a lot of the symptoms that diabetes leads to, alcoholism can lead to those same symptoms. Why? Well, because they both have a major negative impact on the liver. So that, at the end of the day, you can't be drinking booze if you're diabetic for sure.
Well, they might be hammered and accidentally clicked on the button to watch this. So, but guys, that's kind of our intro to diabetes. We just want to break it down a little bit. We want to go into a little bit more depth and detail, and maybe look into our testing and really like what we look at when we're looking for diabetics. Like if we have a diabetic, do we check blood sugar and A1C? Sure. It's a good thing to know and good thing to monitor, right? But that's all they do. And is that the answer? No, because that doesn't explain why and what the heck is going on, right? And so we got to figure out what's going on, what's underlying, what's triggering, what's causing it. Tonight, we're actually doing a diabetes webinar. And so I put the link in the comments there for you guys. If you haven't if you haven't registered, or if you know somebody that needs to register, make sure you do it. It's tonight at 6:00. Dr. Miller will be doing that. And it will blow you away with the stuff that we're going to talk about, that he's going to share with you. And more importantly, I think it'll piss you off. And the reason why is because you have been told false things about diabetes and about your health your entire life. And enough is enough. And tonight is the time for change. So
listen, I'm good with people getting angry as long as you direct that anger in a good direction. Right. Get pissed off, because listen, you're going to get frustrated with the current approach that you're taking right now is making you sicker. And I'm going to explain to you exactly why. It's not my opinion, guys. It's not my opinion. The standard of care in our country is you will get worse over time with diabetes. That's not the way it needs to be. And don't let anybody ever tell you that's an irreversible disease process, because I've seen hundreds of people completely walk away from it over the last almost 10 years we've been doing this, guys. And so tonight, tune in, because I'm going to have a lot of fun. We're going to have a lot of fun. But at the end of the day, we're going to get some real good information that literally, there's some things you can start doing right away to start moving towards the right direction, and stop moving towards a sicker and sicker lifestyle. So pumped to be on there tonight, guys.
But here's the deal. Like, people don't want to know that it's reversible. And we probably already lost viewers to this, and you've already pissed people off saying that they can get rid of this because they want that flipping excuse. If that's you, get off that damn excuse. No more. Feel healthy. Do you remember we ask this question all the time. When was the last time you felt well? When was the last time you were healthy? When was the last time you were healthy? And you will be amazed that people can't answer that stinking question. What do you mean you don't know? You're 50 years young and you haven't felt good in 20 years? That is unacceptable, but you have accepted it. And you think that's your normal. Well, let's make a new normal, because you can do it. It starts tonight, guys. That webinar tonight will give you the answers. I say this all the time. Tonight, I guarantee you will walk away with hope if that's what you're looking for. If you want to become non-diabetic, if you want to reverse this, if you want to get healthy, if you want to get off your medications, you will learn how to do that tonight. So get in there, share that event around with anybody that you know, that you love, that you care about, that has diabetes, that needs to get answers. We'll be sharing that tonight. This week, stay tuned. We'll be doing a ton of stuff on diabetes. Again, educating you and just blowing your mind about this. So anything else, Doc?
That's all I got for today. You guys have a blessed afternoon. We'll see you soon.
Awesome.